This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Lauren Tancredi is a contributor to several successful ventures within the private medicine and wellness sectors. She is a serial entrepreneur whose personal experiences navigating complex healthcare systems led her to her current role as co-founder of MEDICAVA. Lauren's expertise in the business of private medicine, matched with her astute perspective on the 360-degree approach to strategic planning and practice operations, has allowed her to launch, build, and grow retail-based clinics throughout the United States since 2008. Highly respected among her peers in the private medicine community, Lauren's contributions continue to influence the industry and be proven invaluable. Serving as both an innovator and educator, Lauren helps establish direct relationships between practitioner and patient. Her style and scope of work are considered to be the gold standard, making her a highly sought-after consultant. Lauren launched MEDICAVA as a response to the rapidly changing healthcare landscape, recognizing the restraints that were being placed on physicians who were no longer able to achieve their dream of truly healing others. Lauren's unique approach to implementing customized membership-based care and programs gives providers the opportunity to practice autonomously as an alternative to traditional healthcare systems. Welcome to the podcast, Lauren.
Oh, I'm so excited to be here, Dan, with you, Marielle. It's always fun.
Yeah, it is. And, it's crazy because usually, we're in a classroom setting, so to speak, virtually. And I'm just listening to all of your genius, but I'm so excited that you get to, share your message and share where you've come from in your journey and how passionate you are about the direct care movement with more people in the audience. So let's get started. So when we talk about your involvement in direct primary care as a business model, direct care for those specialists out there, the different clinics that you're working with, how did you even get started in working in the healthcare business?
Oh, gosh. Well, first, thank you for being my #1 student and showing up and asking questions and being curious. Because if you're not doing that, then entrepreneurship is going to be a really hard journey for people. And I think I did the same thing at one point in my life. I was asking questions because, like many of you, I've got stuck in this really complex healthcare system when I got in a car accident, got my appendix out, got my tonsils out with in the short time frame. And I literally remember being in the hospital thinking, after they took out my appendix, they called me and they're like, hey, your bill is going to be it was $17,000. And I was 20 something years old. And I was like, this is not right. How is this happening to me right now? And I left where I had been living at the time in Florida, went out to Las Vegas, and I started working for a clinic called Stenogenics Medical Institute, and they promoted hormone replacement therapy. But I wanted to help people. I've always wanted to really help people. And one of the beautiful benefits of working with them is that they actually would pay for college if I wanted to do something related to what they're doing. So I'm I'm going to be a nurse because that's how I'm going to help people. And then I remember sitting in a biology class, like learning about the inner ear. And I'm like, what the hell am I doing here? Like I could give two cracks about what's in your ear. Like I am a business genius, like, and so how do I use what I've learned in business and sales and promotion to support people in getting out their message? And so that's when I started working with Dr. Life, and he was writing books and we were going on tours. And while it wasn't direct care, it was like really a taste of what membership medicine was for me and how we get to build relationships in order to cultivate sales and patients that generate outcomes in their life. And so it was really my first kind of introduction to this private pay, concierge, direct care space. And from there, I met some really, really great people that were really trying to bring innovation and affordability into healthcare and makes it more transparent.
That's awesome. And I think that as people have heard on this podcast, when people are opening their stories with the story of where they came from, it just really helps us all relate to each other, but also it helps us understand, your why and why you're doing this and why you're so passionate about helping everybody you've helped up to this point and who you will continue to help going into the future. So with that, as you talk about, that it wasn't necessarily direct primary care as a business model that you were exposed to working with Dr. Life and doing, and being out there as you were starting to help people and help clinics. How did you come to learn about direct primary care as a business model? And how did you start shifting your focus to DPC focused clinics?
Yeah. So during my time at Synergetics, I met a guy that started a company called N1 Health. It was similar to like an MD VIP. And what I learned really quickly was like, when you're having to explain what concierge medicine is on top of membership fee, like it's so complicated. And then all of a sudden this DPC thing comes into the world and it's like, actually, we're not going to double dip and we're not going to do these things. And it's like, oh my gosh, I've been speaking this language, like cash is king all day long. Like tell me like one flat price, how to do it. And so we started to evolve the practice models into more of a DPC type offering. And part of my exposure to that was through Hint. I mean, I started using Hint Health back in 2013 when they first started, like bringing people onto their platform and then like coming into these places where I was going to medical conferences and meeting people and also even functional medicine practitioners, like they all needed to do something differently. And the complication piece was the insurance piece. And so when we take that out of the equation, we know what happens. It's like magic. It makes so much ease and grace. And also there's an education hurdle that we get to come across when we're like talking to consumers and like trying to educate them on what this thing is, right? And so I would say probably in 5 to 6 years into my kind of like more concierge style medicine and background, I started to see direct care taking off and like really starting to make a way. And I'm sure it was doing its thing before then, but it was like, oh, this actually simplifies the process even more. How do we make this work?
And I love that, you're coming from it from, a non-MDDO perspective, clinician wise, you're focusing on your business genius and looking at this model as a business model and, a very clean model in terms of like, we don't have to justify the fact that you talk to a family member about your dad or whatever, because there might not be a code for that. And we don't have to like waste our time looking for a code to represent how do we take care of patients. So I love that. And when you come into the DPC ecosystem, thinking in your business genius space, I want to ask about other things that you see in the direct primary care model. In addition to everything you've shared so far, accessibility, the cleanliness of or the transparency, I should say, of just, we work for our patients. When you're talking to other business-minded people and not necessarily clinicians, what do you say to them are other pros and cons about the DPC model? Because I think that, not everyone who has a business background understands the differences between concierge and direct primary care as a business model, but also, they do understand, when it comes to P&Ls, when it comes to efficiencies, when it comes to other things. How do you talk to people who are coming from the business perspective about DPC?
Yeah. So I like to say, you save the life, we'll save the business, because I don't like to step in the clinical genius space. Like you guys have gone through years of training, you bring different expertise. And so like, I think it's a really nice kind of meld when I bring like okay, share with me, like, what is the dream that you envision for your practice? And then we can start to look at all the tools and like support that we get to put in place to make this thing work. As a micro practice is a lot of the clients that I've worked with in my experience, right? So starting from there, and then in terms of like looking at it through a business lens, looking at DPC through a business lens, it's like, how do we make sure that, one, it's still affordable to the end consumer, but it makes you guys money to pay the bills. And so what I've experienced is like, this can be something that's done, I mean, to your point and experience almost, Marielle, like with a very low overhead. Like you can start with house calls, like you can dip your toes in the water here and also serve a population that still might be at need. We know that there's still a large pool of people that are uninsured and underinsured. The other big thing too, and when I think about this, is like, from a business perspective, like I've talked to friends, and I was telling this story the other day, and the DPC accelerator through Hint was like, my friend's like, I want to quit my job from Amazon. I really want to quit my job at Amazon, but I'm afraid because I don't have health insurance. And I was like, well, let me tell you about this thing called direct care. And this is how, no way, that's how much it would cost me. Like, that's nothing. Like, I thought I was going to be coming out of pockets. And it's like, you solve a huge problem for people that are trying to do the same thing that's similar to you, which is remain independent and autonomous in their work and creativity. And I think that's part of like what's really in the set of pros about DPC is like, you can still be specialty within your family medicine niche, right? You can still take care and align with the patients that you really want to serve and expand your focus and bring in new technologies. And like, you have time to like live and breathe the things that you're practicing and maintain a healthy lifestyle for your health yourself as a practitioner, but also like you're walking the talk for the patient, which I think is huge. And when we're looking at folks that are like in traditional fee for service, like you're promoting like or decrease your stress, but you're in burnout yourself. So how does that even work? Right. And so those are some huge pros. I think like in order to be effective in our leadership, like there has to be a way that we're like walking the talk. And it gives you as DPC providers so much room to like do the things and have the experiences and almost be on the journey alongside the patients that you're wanting to serve. So, plus you get the things of like accessibility and, we've done really cool, innovative things with the practices that I work with, like building programs on top of it, having group walks. One of the things I'm a huge proponent of is like learning in groups, right? It's like, you don't have to do the one-to-one to demonstrate the value to your patients, like do town hall meetings, one of my doctors did track walks for years with his patients. And then they would go on their own little group and do it themselves. And they became champions like of their own health. And it's like, it's so cool because insurance doesn't pay for that. And if it does, like you said, you're digging through a book to figure out how to make it work and why, when you can be in like your creative genius and expression and like really evoking these feelings of health and creating outcomes for people, not just like in the context of like, take this and feel better, but like building community, right? Building trust, allowing people to feel seen and heard and cared for in a different way.
See, this is why I could talk to Lauren all day. Like I just love your history. I love what you're doing. And I love that, that you're free to do these things. And there's people who have, jumped off the cliff or whatever into the boat of autonomous practice and of freedom to be able to meet you there when you're talking these things, right? Like, it's so awesome because like you talk about, like, if you're trying to tread water, like I think about my water polo, my single season of water polo, I was just like, I'm treading water here. Like, that's how it feels being, you're constantly trying to just survive in fee for service. That was my experience. And so, I love just being in this space where we can talk about, and then there's this other way of doing care. So when it comes to DPC and physicians and whole clinics who are going from even fee for service to a DPC model, or people who are starting from the ground up, I want to address it's this big, like discrepancy between I'm super confident to go to medical school, but I'm super not confident to open a business. How do you address that with people who are like, but I don't have a business degree?
Yeah. Well, that's, one, why there's beautiful resources like your podcast, like the DPC community at large is so giving. And then I would say business is for giving, right? And so I think that one of the most challenging things I have with my clients who are predominantly physicians is like, get out of your own damn way. Like you are like creating barriers and obstacles where there doesn't even have to be any, right? And so entrepreneurship, and somebody had written me an email this morning, like, He's like, this has been like self-therapy because all your stuff starts to show up. All of your like you said, like the chatter in the mind, like, oh, you think you can do this? You can't do this, right? And frankly, you guys probably took a beating in medical school. I don't know because I never went there, but I could imagine like not having to kill anybody is a big responsibility to take onto your shoulders. And so like, there's a lot of folks that I have been working with in a consulting and coaching capacity where they're like worried that they're going to break something. In business, it's like you can break it 5 times. It's totally cool. You know, like your customer's always right. As long as you're honest and transparent and you show them your humanness, like it totally doesn't matter. Then, you know, we're just become perfectly imperfect humans like everybody else that's walking the planet. The only difference is like you're chasing your dream and you're creating impact in people's lives. Like remind yourself of that every single day. And so, you know, I like to work with intentions. I like to make sure that people are affirming what they want. And like, sometimes we've got to just like keep telling ourselves until we believe it ourselves, right? Like, I can do it. You can do it. It's like Tom's the train. He's coming up. Yeah. You know, like, so yeah, I think, you know, the biggest challenge that I experience folks having is like having to do it right, having to do it perfect. This gets to be your playground. Like it is a sandbox, build it, knock it down. Like it is totally forgiving in business. It's just about your ability to get back up and do it again.
When we talk about the, you know, showing up and being ourselves, when people have already made the jump, like myself, it's like, oh man, I know exactly what you talk of. And that is totally real. Mm-hmm. I want to go to the idea of, you know, how you say business is giving, but also we're seeing this like, but I'm not a salesman. Like I feel like ick about, you know, selling a practice. Like I don't like to talk money. I don't like to talk finances, but I do want to do DPC. How do you respond to people who have those concerns?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yeah. Well, I would say one, it's all energy at the end of the day, like whether it's dollars or hugs that you're asking for in return for your services. Like I think that there's this mentality around being a healer, and I'm going to call you a healer and I'm going to get a little spiritual woo-woo on you, but yes, you guys are here. You're here to heal. You're here to help support each other. And somehow along the lines of our thinking and our societal beliefs and norms, it's like, well, if we're helping somebody, we can't get an energetic exchange. And that's all money is. It's like, hey, I'm doing this thing for you. And in return, you're doing this thing for me. So I can keep showing up doing this thing for you. Right. And so it's also really funny to me that, you know, physicians don't think they're salespeople, but guess who's writing the scripts? Guess who's creating the care plans? Guess who's enrolling people in their journey to health? Like you are selling people all day long. And so what if we took that context that you show up in the room where it's like, hey, I'm going to sit here. I'm going to ask you like, what did you come in here for? No different than like, how did you hear about me? Let me like, what do you need? Right? What are your chief complaints? Like, what are you looking for in a practice? It's the same kind of journey that you're going on, whether it's behind a closed door or over the phone or face-to-face with a prospective client. Like we're just getting curious. And then at the end, we get to make the recommendation of, hey, I think you'd be a great fit for our practice. Here's how it works. Right? And it's like just moving into that money conversation. But for so many of us, we weren't taught about money in school. We don't necessarily like balance our checkbooks like our parents did. Everything's digital. We don't even touch money anymore. So our relationship with it is like out the door. And if you remember, Mariel, like one of the first things I said to you is like, start looking at your bank account. Remember? I was like,
every Friday. Yep. No, I totally remember that. And I literally, again, I was telling Lauren this before we started recording, like I hear her voice, not in some crazy diagnosis code way, but like literally I'm like, oh, Lauren said to do this, so I'm doing it. So I love that. And I love that you're calling out all of us who are talking to patients about like, this is what I recommend. And, it's coming from that place of, oh yeah, like I actually do recommend things and people actually do understand, where I'm coming from to recommend things specifically medically, as well as, socially, whatever. And they take that information to heart. That just being in that space has allowed me, I don't know if this happens with other clinics that you work with, but it's like, that's allowed me to not even focus on the like, oh, I'm not a money person. In addition to checking, Financial Fridays, I have come to talk to people during meet and greets about like, this is Big Trees MD. This is the clinic we offer. And money doesn't even come up until the very end of the conversation because they've already gotten I want that care for me. Like I can get that care. Like you do that here in Arnold. And so when it comes to the meet and greet and people feeling confidence about going into this meeting where they're still, they might still be getting comfortable with talking about what they're doing. There's people who open with the pricing of the practice. There's people who open with what is direct primary care. And then there's people who like myself, I'm talking about like who I am as a physician because people are wanting me as their personal doctor. How do you talk to people about the finessing and the, the envisionment of what is the purpose and how to effectively communicate the purpose of the meet and greet?
Yeah. So this is the art of enrollment, right? This is the thing that we were talking about before is like, how do you get people to believe in the vision? And even when you're writing the care plan, you didn't go say, hey, here's your prescription. Now tell me what's wrong with you, right? I mean, it's no different than that. And so really what we're doing is so many practices that I've been interviewing to kind of like, I ask a lot of the times, like, what do you want your patients to feel like when they leave the conversation or they leave the clinic from you, right? And the majority of people tell me, I want them to feel seen and I want them to feel heard. Now, and if I'm coming at you and I'm like, hey, I'm interested in becoming a new patient, and all you do is tell me about the features and benefits and the doctor, do you think I feel seen or heard, right? And this is the art of enrollment. It's like, how do we allow ourselves to step back, hold space for who's showing up at our doorstep so that they can feel seen and heard, and then we can like provide a solution. And to your point, Mariel, then they've experienced the essence of you. Then they know you can hold space for them and whatever challenges they are. Or maybe you guys decide like, nope, it's not a good fit because personality wise, it doesn't work here, right? But this is the art of enrollment. It's like, you let them do all the talking because essentially they'll sell themselves. You just got to show up energetically being who you are.
I love that. And that's, the last conversation I had a couple of days ago with a potential new patient. It was like, for me, I spend 15 minutes. It's been a work to rein it in because I love to talk, to get it down to 15 minutes. It used to be 21 minutes, but what I would say is that for me, when I open the conversation, I'm like, what brings you to this meet and greet? Like, how can I help you today? What brings you to even looking into this model of care? Because it's different from, what you typically see in our area. And for me, it's things like that help open the conversation. And then you're right on in terms of like, I get immediately what that individual is looking for or that family is looking for. And that could be like, we just want access, or we just want a person who actually knows us, or we just want to know, like, is there another way to do care in terms of, do we always have to use our insurance because we have a high deductible plan? I'm like, that's a sort of a loaded question when people ask that, because I'm like, that's perfect pairing for that. But it is so true in terms of just the idea of like what brings you to the practice and giving that space to the patients or potential patients to share. And we make it clear, and I'd love to hear your recommendation on this, but like, we don't focus on give me all your diagnosis codes and I'm going to treat you over the phone because it's just a meet and greet. But when it comes to like, what brings you here? What are you looking for in a practice? Like, when's the last time they had anybody in healthcare ask them that? Right.
Right. Totally. And so it's like, to your point, like if you're showing up with an attitude of service versus sales, the whole game changes, right? It's just like, how can I serve you today? And that's really where I focus. Like when I was selling at Synergetics, it was $30,000 a year. Like it took me 6 months sometimes to get patients to be enrolled. But how did I show up? I served them. Like I sent them articles. I like followed up with them. And then all of a sudden, when they were ready, they came back to us. And so, I like to think a couple of things. One, every no leads you closer to a yes. And every no doesn't always mean no. It just might mean not right now. So for those of you who are not taking down phone numbers and names and email addresses, you are losing out because you do not know when the time will be right for those people. And I was telling Mariel before I got on the call, like for the last 2 months, my team has been secret shopping direct care practices across the country. The majority of you are not answering the phones. Some of you are not calling people back. And there was a few like real diamonds in the rough that really got it and got into it and asked us about, who we are and what we're looking for. But most of you didn't even ask our name and phone number. You just went right into pricing. And so to your point, Mariel, earlier, where it's like, hey, I asked them, and then all of a sudden they told me they were looking for access. Now I can solve the problem with access. But if I just come out the gate not knowing that's what they're looking for, how am I solving for them? How am I serving them today?
And I love that, as you talk about every no is closer to a yes, like it's also a yes in your head that you can mentally and emotionally do these meet and greets, because it's like, every time you practice is another time you've practiced doing your thing, like your representation of what you're bringing to your clinic and what patients will experience in your clinic. And I love saying that because, I have all of these people who have reached out and are like, I'm so bad at this. Like, it's very self-judgmental and self-deprecating. I'm like, but you are one meet and greet, more experienced than you were prior to that last meet and greet that you just did.
Yeah. Yeah. It's like everybody wants to come out the gate perfect. Guess what? You are going to fumble and fall and, your tongue gets tied. I do it too. And I've been doing this for almost a decade and a half. Like I get tied up. And then sometimes I'll say something genius and they're like, what was that? And I'm like, I don't know. Thank God somebody recorded it because I don't know. It just comes out the tip of my tongue. But even one of the guys that's in our cohort right now was saying to me today, he's like, there's some people that are saying no, and it's hard for me not to make it mean anything about myself. And it's like, dude, it's got nothing to do with you. If it's got anything to do with you, then we got to seriously consider why these people were your patients before they were even at this new instance of your clinic. And what I encouraged him to do was, all right, this, you're just a beginner. So if these people had been your patients previously in a fee-for-service environment, why don't you ask them, hey, I'm just getting started at this thing. I am not a business owner. I'm a really good doctor, or at least I think I am. So I'm going to take you saying no isn't about me, but I'm curious, where did I fall short in making you say yes? Right. And what do you have to lose? Right. We're so afraid. And a lot of times, I get on these calls with doctors and they're looking for the next thing. What should I be doing? And it's like, dude, actually, it's probably been right in front of you all the time. Did you follow up? Did you get the phone number? All of the pieces are coming at you. It's just a matter of how are you present enough in your business to see what's possible? Because what happens is, I know you guys too well, you get so busy doing the things, looking for the next thing that you fail to see what's right in front of you, the pasture in front of you.
So this next question is about tech, because as we are scrolling all over the place, I love to tell people I don't have an addiction to drugs, alcohol, or tobacco, but I do have an addiction to tech. I geek out so much when it comes to tech. And when there's so much tech out there, and when we can squirrel all over the place with how do you think about tech stack? What is a tech stack, first of all, in your mind? And how do you recommend that people approach building their own tech stack?
Yeah. All right. So tech, love it or hate it, it's here to stay. And you might as well use a little bit of it, if not a whole lot of it. But what we find on average is most people in practice have between 12 and 20 pieces of technology that they're using. Now, the biggest mistake that you can make is that people aren't managing it on the other side. So we're asking the patients to put in their data and then nobody's responding. So what happens? You're eroding the patient experience. So I like to think of a tech stack, but more importantly, an integrated tech stack of one that actually starts to flow communication across programs or softwares. And while it won't happen for 100% of all the things that you're using due to different HIPAA compliance and APIs and all of that kind of stuff, that get the majority of them working. So if we think about, Sprint, Hint, and Elation, they have a little bit of a trio going on there. That's what I've recommended for years to people, right? Then you start to bring CRMs into the space, so let me back up. So definitely we need our EMR, right? Preferably with a patient portal. Ideally, if you guys can limit your characters on it, that's been a big help for a lot of folks that I've managed, because it's if you can't ask it in a tweet, you probably need to come in for an appointment, in my opinion. as a non-clinician there. And then, do you want self-scheduling? That's a whole nother thing in your EMR. Then you need your, HIPAA secure messaging through an instance like Hint Hint All-in-One or Spruce I've used for years. Billing management, another great piece of tech. And then a CRM. Like, I feel like those 4 things you'd be really good, like in terms of practice. CRM, questionable, but in my opinion, again, if you're doing the sales piece right and getting people's phone numbers and names, like, you want a database to store them in, or at least a spreadsheet, and a CRM, which is a customer relationship management tool. I like to think of it, for those of you who are not techie like Marielle and I, like, it's like an EMR, but for sales and marketing personnel, right? It's like, it's got all of the things. So I can get my follow-up tasks in there. I can write notes on the people, how they heard about us. I can put out email blasts, right? And so highly recommend, if you're somebody who really wants to grow, invest in that type of technology. And so when we get all those things working, it's like really great, because now our EMR can tag the patients, it can update our list in the CRM, and like, that's like fully integrated tech stack. I will, if it's okay, I'm going to do a shameless plug here, but on our website, which will be in the comments below, we have got a free tech stack checklist, which you can go through and like figure out, like, what are the different tools that I need for clinical management, for patient experience, right? So then if we think about patient experience tech, it's like, are you using like wearables or, an in-body scale? Like, what are you giving to people to like manage on a day-to-day basis so that they are constantly reminded of their health and that you're there for them, right? So it goes through several, and then it goes through the accounting piece. Like, it looks at all of these different pieces of tech, and then you can put like what you have. And we've got a list of like recommended partners that we work with a lot of the time, so that you can figure out like, what are the gaps in the tech, and is there a place for this stuff? And again, going back to my first point, is like, don't add more than you can swallow, because if you can't manage it on the backside, it's just going to hurt the experience more than help it.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
And this is something that I'm embodying Dr. Christina Dahl out in Pennsylvania, where she was sharing her story, and she was saying how like from day one, she has a spreadsheet of like, this is how much I spent at Target today on these items and all these things. And I'm like, Marielle is in the process of like, oh yes, I need to like list the tech that I have. So that is because for me, I would just like get all this tech. And then I'd be like, oh, these are so cool. And then I'd be like, I totally forgot that I bought that. So we'll have a link in the show notes also, in addition to the click down below in the YouTube video. But, when it comes to helping your future self, I always think about like, how do you help your future self when it comes to even listing your tech stack? And like, for me, having like when I buy something now, I'm like, this is my thought about, could I use this piece in the tech stack to do this? So I can like, it's like my notes. When I read my own assessment plan, I talk to my future self in terms of like, this is what my intention was. But also there's tech stacks out there there's pieces of tech stack out there where like, there might be like a 60-day trial, and then you can try it out and see if it works or not. Like, I could geek out on this all day. Oh my gosh.
I know. And then, just to your point too, Marielle, like, don't like set it and forget it, right? Like, if you are using tech, like, go back in there, go through the patient experience, make sure that there wasn't any like feature updates or broken links. Like, I did one thing once and it broke something, and it took me like 2 months to figure out it broke. It's like, no, test everything and talk to your tech or software providers, because there's probably new features that they're rolling out so that you can get rid of some of the things that you might have had to integrate in because there wasn't a feature, right? On one of the other things. I think one of the biggest challenges that we have in this space is like, everybody wants it all in like all in one dashboard, all of the things. And it's like, it's fairly impossible to get there, but you could probably get close, and then just keep watching who's moving the needle so that you can like reduce, eliminate, change, upgrade, do your thing. So
absolutely. And something for those people who are like, exploring this world or new to the world of what tech you can find out there and what tech might be coming down the pipeline is look for their roadmap. Like that's typically the lingo that people use for, what's on the short-term horizon in terms of what they're building out towards. So now that we've talked about tech and harnessing tech to do what you need it to do, so you have time to do other things like, spend time with patients, where that's where you're working at the highest ability of your training and ability to think and operate. When it comes to boundaries, I want to ask about how you talk to people about, going from this place of you were expected to see potentially if you're in fee for service, like so many people per day, and like every single little code that you can harvest money from, like you have to work your tail off, versus a model where it's like, nope, this is totally different. Like this is a membership-based model. This is, a per visit model for those specialists who are not doing memberships. How do you advise people to set boundaries so that they're not also going into the rabbit hole of like, I work 24/7. I'm going to respond to every single message. And there's those people who want to do that. Yeah. Great. But like, I got 2 kids under 6. So like, that is not in my wheelhouse.
Mm-hmm. Yeah. I mean, I think to your point, like there's some old dogs we can't treat new tricks. They're just going to keep showing up and doing how they do it. And I think that, there's a reason, there was something in your soul that was like, I got to do something different. And it's not just like for the patients, but it's like for you to be time with your family, for you to be home at night, for you to focus on your health again. Right. And so, the first thing is like, what do you want this to look like? Because it's your dream, and it could be anything. I mean, literally anything. You want to work 3 days a week? Cool. Work 3 days a week. Like, I don't care what you want to set up, as long as it's like communicated well to your patients. Right. And so a lot of the work that we do with our clients early on is really understanding what the membership journey is going to be like, but based upon like from a foundation of this is what I want my life to look like from a provider standpoint, right? How much time I want to put in, how much vacation time do I want, so that we can figure out like, what does utilization look like based upon this pathway that you put forward? And while people may only come in twice a year, like typically we say, come in for an annual physical, a follow-up, 2 acute care visits, a couple telemedicine visits. It's like 3.5 hours that we might see per member per year. And so how many people can I serve if I'm working part-time at 1,000 hours, full-time at 2,000 hours in a year, so that you can really start to shape your experience, right? And then you got to carve out time for like admin and all of this other stuff. And so before you even get your first patient, I'm like, meditate on what your days get to look like. Start to bring that stuff into light. And then we'll start to put this framework of like, okay, what do I need to carve out so that I can operate with ease, grace, and have fun in this space, and market my practice and look at my finances and, right? Like there's a lot of little nuances, and all you have to do is set time, because from that place, now I can say, hey, when you're due for your annual physical, this is what happens. This is how it happens to follow up when you need same day, next day care. And for those of you who are worried about urgent care, like text messages after hours, like this is what 911 is for. This is what I am for. And when you need your pharmacy refilled at 5 o'clock on Friday, good luck. Like that's not an urgent thing. You should have thought about that days before, because you are being responsible and you are empowered for your health, right? And you just like set these boundaries up front, and we do it through an onboarding process, right? Where we have a welcome kit and we put together all of these different things on how to be with the practice. And then we teach people. We teach people and we teach people, and then we teach them again. And then we remind them, and then we teach them again, because that's what the gold standard, like brands like the Ritz-Carlton and Nordstrom Racks, that's what they do. They keep teaching their people so that they can be empowered to show up in the way that serves.
I love it. And, literally right before this call, we were doing a screen recording on my phone about how do you refill medications in our patient portal, because for some reason, like we needed to change our YouTube video of this previous posting, because our nurse has multiple people asking like, how do you refill medicine? Or like, where do you go to refill medicine? It's like, great. Like when you get questions asked over and over again, or that you're going to expect that patients will ask you like, how do you refill a medicine in this new practice that I have joined? Thinking about how can you do things like like literally a screenshot video on the phone. It takes a minute and 21 seconds officially of that last video. And then we have that link permanently so that we can embed it in whatever we need to. Onboarding, like you're talking about onboarding, welcome kit, a auto reply to patients asking that over, a portal message or texting app, so thinking about if you were a patient experiencing your practice from the get-go, how would you want it to be? Could you put yourself in your patient's shoes to see like, oh yeah, that could be frustrating. And, always think about that you can change your practice because you don't typically have 16 administrators telling you like, we're going to have to take that to committee and then 16 committees will have to approve it. And then we will be able to see yes or no, or we will defer that to a different year.
Right. Yep. When your advisory board is like your dog and your kids, like it's easy to get things done. You know what I'm saying? It's like, and this is the hard part. Like we've been so conditioned to like show up and do for others. Like this is the creative play space, right? This is where you get to make anything happen. And like Mariel said, like, and I've already alluded to, like, usually what you need to do is showing up right in front of you. When there's people asking the same 5 questions, solve it, right? It's like you're constantly being shown where you get to navigate. It's your duty to respond. Your duty to respond to these folks and to build a thing that feels aligned. And if it's not feeling aligned, then get rid of the things, right?
Absolutely. So when we talk about being in alignment with our practice, with our patients, I want to go now to finding people who are in alignment with understanding what DPC is as a business model, what membership models are. And, for me, I had created this Yelp-like directory of a bunch of resources that is actively being built out and added to all the time with people who are understanding of direct primary care, where people within our space can leave reviews about, my experience with so-and-so. And the reason I was inspired to do that was because I had so many stories that broke my heart of like, I had my nest egg for my DPC and I invested it in, such and such vendor, such and such tech. And at the end of the day, it wasn't in alignment with DPC. They didn't even understand DPC. The copy was so bad. I had to pay someone else to, build my website again or whatever it is. And so when it comes to being in alignment with your own practice and reaching out to people who are in alignment with DPC and understanding of DPC, how do you advise people to talk to, whether it be a tech company or whether it be a consultant or a marketing person? How do you talk to people about these are the strategies of how to actively find someone who is in alignment with the type of practice that you're trying to build or you're growing? Yeah.
Well, I think that usually like when you get clear on what it is, what or who you want to call in, it will start to show up for you, right? Like I believe that that things start to come and flow. You start, they call it saturation in marketing. It's like, oh, when you think of a Tesla and you want to drive a Tesla, then you see 10 Teslas on the road, right? Like, and so again, pay attention to those universal signs. And there's no coincidence that the people that you're meeting in this direct care space, like have likely been through the same challenges that you have. Ask the community, right? And then from there, do a meet and greet with the organization, go take a demo kind of to your point around tech, like play with the software. Does it make sense? And talk to people that have been through the experience. I mean, every single person that we talk to, we go through like a discovery call. We interview them for the practice. We interview them for more for us than we do for them. Like, I know I can help pretty much the majority of the practices that come in, but it's like, who do I want to work with? And so for me, it's not just like the tool or the tech. It's like the energetic alignment. Like, are they serving like, do they want to create impact? Are they putting outcomes before they are putting dollars, income? And so, and I want to work with people that are like, have on the mindset of like being a beginner again and being curious and open. And, there's some people that love being in this like kind of startup space because they can be contributors. And then there's, other tech and folks that have been in this for a long time that understand the framework and can go. So it's like, it's really about aligning your values with who you're working with at the end of the day. And to Mariel, to your point, it's like, there is a universe or an ecosystem, and it's through like DPC Summit and the Hint Summits and the Health Rosetta Fest and like your directory. And like there are, DPC Frontier, like there's things out there that can point you in the right direction. And when all else fails, ask. And if you're afraid to ask your peers, your colleagues, the folks in the DPC community, you're going to have a hard time asking for the sale from your patients. So start getting comfortable being uncomfortable and showing up in ways that you probably never thought you'd have to before, because this is the gold. This is where everything starts to unlock for you.
And everything towards that goal is so meaningful, and it really like returns, like you've been saying all along, it returns you to yourself. You can think about like, how can I show up to help others, to put my intentions out there so that I'm doing what I'm proud of at the end of the day. And so that, as a physician, like we're doing the best for our patients without getting the stressors of like, well, I wanted to do that, but it's not on your formulary. So,
Right.
I absolutely love that. As people are growing their practices, something that's coming up now is, what happens if you're a physician who's looking to retire in the next, 5-10 years? When it comes to how to value a practice, this is something that isn't talked about a lot. I was talking to my cousin who worked in a family practice clinic in Canada, and then she is now a hospital administrator. And she was talking about how, she understands direct primary care in terms of like what the model is, what it totally makes sense from a business perspective to her. But she was talking about how she would still think that it's important to do things like code your visits in terms of the ICD-10 to potentially say, like at the point now I'm ready to sell my practice. This is where I can say like I have, 75% of my patients have hypertension, or like 20% have diabetes. So this is what you would be expecting to, take on if you were to buy my clinic. How do you think about and how do you advise people when it comes to how do you value your practice so that you could potentially have a dollar amount to be able to sell, not only, go from a space of selling to members, but also then to sell to other clinicians or other physicians your own DPC?
Yeah, I mean, that's a great question. And I don't know that we have a ton of evidence or data in the space that will show that there's a formulary for doing it. And I think, again, like we're in this early adopter stage. I feel like we're crossing the chasm. Like there's been a lot of momentum in the last couple of years. So like we're finally taking that leap in terms of business and awareness. But, traditionally fee-for-service practices would evaluate the assets within the practice. And that's like, okay, you're getting paid for your computers and your chairs. And that stinks at the end of the day. And so really, I think that, it's more of like creating a succession plan than anything for folks. I mean, that would be my recommendation is like, don't just pull out and sell, like bring somebody in, start to transition your patients so that there's actually value and you can actually do like a formulary like EBITDA, right? 5 times your EBITDA so that you can actually have a dollar amount at the end of the day, because if the patients don't stay, when you leave, you're in trouble. So it's like, it's like, I think that there has to be like a short-term investment for a long-term gain where you're like actually working and co-facilitating care plans for patients in order to effectively move. I mean, that would be my humble opinion. I don't know that there's even a real like solid answer to advise people on, but I think that once we start seeing these folks, like the first generation of practitioners retiring, like they did so many other ways, like they're setting the foundations for like what we actually get to put into practice.
And one example that's fairly recent as of the date of this recording is Dr. Allison Edwards. When she sold her practice to Dr. Kylie Vanneman, there was a period of transition, and she talks, it's episode 89 of my DPC story, about how she transitioned her patients. And, I definitely think about there will be a point, just for my own personal choice, where like I would like to do more traveling than practicing of medicine. And so that is years down the line, but at the same time, thinking about your words, how you said, in one of the sessions that we were on, what's your 1-year plan, your 3-year plan, your 5-year plan, your 10-year plan? And for me, that would be potentially in the 10+ year plan to think about, because I think about how frustrated I get when I don't, do things like record my tech, like I shared earlier. But if I think about like, it's not today, but I'm planning for the future, just like investments. How do you think about your practice to be able to address that issue in the future? I think it's super important for us as a movement, but also individually to think about, so that we are thinking about alignment with our future selves.
Mm-hmm. Yeah, absolutely. I think that's a huge point. And at the end of the day, I think we all get to write our own story, like whatever that looks like, including like the sell of our practice. It's like, can you have the same amount of passion and excitement that you do for DPC when you're selling a patient, when you're actually offering somebody to step into a turnkey business? Like it's fairly priceless.
Awesome. So with that, specifically at MEDICAVA, what is coming down the pipeline for you guys, and how do people get in touch with you after this podcast?
Awesome. So I think below in the show description, there's going to be a link to our website. Go there, get your tech list if that's something that's exciting for you. But, we're in the business of being practice architects or practice implementers. Like, you dream it, we design it, build it, make it flow and go, whether it's tech or systems operated, right? And then our sweet spot's been sales. We've been doing sales for a half a dozen practices across the country where we take all of the inbound phone calls. And what we've noticed, and to my point around, like, we've been shopping practices to find out, like, hey, I keep hearing this thing called my practice isn't growing, but when you're not answering the phones, you're not doing the follow-up, you're not marking down people's names and phone numbers, you're failing at sales. And so we're launching this sales mastermind, the art of enrollment, in the early fall, September, to really help hold you guys accountable, to work on calls with you, to do outreach, like to literally like be the mentor in terms of the sales game. And so that's the most exciting thing that I have on the agenda, because it's like, I never thought I was going to be a salesperson, and here I am doing sales all day long. It's like, how is this happening? And it's like, oh, I just get to be the experience of me. And like I said, people will be like, what did you just say? That was so awesome. I need to like write that down. It's like, I don't know, I'm just being myself at the end of the day. So how do we show up authentically in sales and use the tools that we have so much access to at our fingertips? It's like so exciting, the technology era that we live in, and scary sometimes, but more exciting than not, that we can really like harness these tools to help expand our reach and our impact.
Awesome. Well, thank you so much, Lauren, for taking the time and sharing about what you are doing at MEDICAVA, and also just about, empowering people to think about their practices and to grow in their practices that are in alignment with their why and their future.
Yeah. Thank you for having me. It's always fun to connect with you and talk to the DPC family.
Next week, look forward to hearing from Dr. Stephanie Phillips of Front Porch Family Medicine in Royston, Georgia. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.